Our session today regarding practical pathology is about systemic pathology, starting from female genital tract. One of the most important lesion and common lesion of the female genital tract is the genital wart. Genital wart, what's called condyloma acuminatum. These genital wart or venereal wart is composed, this section composed of papillary configuration of squamous epithelium. Papillary configuration of squamous epithelium, benign looking squamous epithelium arranged in finger-like, shaped like this, without any atypical or malignant change. These papillae or these finger-like projections are composed of benign squamous epithelial cells, benign squamous epithelial cells arranged in stratification without any atypical or malignant change. This is called benign venereal wart or called condyloma acuminatum. It is a benign lesion caused by human papillomavirus, either strain 6 or strain 11. This is condyloma acuminatum. This is benign lesion of the venereal area, what's called venereal wart, condyloma acuminatum or wart. This slide regarding the pathology of female genital tract. This biopsy has been taken from the cervix, representing inflammatory process, what's called chronic cervicitis. In this lesion, there is benign-looking squamous epithelium underlying by benign-looking stroma, show the chronic inflammatory cells infiltration, mainly lymphocyte. This area represents inflammatory cells, an aggregate of inflammatory cells, and this also there is some inflammatory cells here. These cells are chronic inflammatory cells, mainly lymphocytes. Higher power showed the inflammatory cells infiltration, mainly lymphocytes and histiocytes. Lymphocytes, small dark cells, plasma cell, and these are the largest one, histiocytes. These inflammatory cells are chronic inflammatory cells. These cells also are lymphocytes and histiocytes. Lymphocyte, histiocyte, lymphocytes infiltrating the stroma. This is example of chronic non-specific cervicitis. Chronic non-specific cervicitis. Benign-looking squamous epithelium underlined by stroma, heavily infiltrated by chronic inflammatory cells. This is a chronic non-specific cervicitis. This slide represents a benign tumor of the myometrium, what's called myoma or fibroid, or scientifically speaking called leiomyoma. It is a smooth muscle tumor, benign smooth muscle tumor of the myometrium, forming round mass with a gross picture of whirling appearance. This is microscopical section revealed bundles of the smooth muscle, benign looking smooth muscle, interlacing bundles, transverse section. This is transverse section, this is longitudinal section of a smooth muscle, interlacing bundles of a smooth muscle proliferation. These are benign cells, smooth muscle, benign smooth muscle cells. These are also benign looking smooth muscle cells. There is no atypia, there is no frequent mitosis. Higher power is more demonstrating. These are benign looking smooth muscle cells. These are the nuclei. These are the bundles, and this is the transverse section, and these are the interlacing bundles, interlacing bundles of benign looking smooth muscle. No evidence of atypia or any malignant change. This is leiomyoma or fibroid or myoma of the myometrium of the uterus. This slide represents a benign lesion of the myometrium of the uterus. It is called adenomyoma. It is similar to fibroadenoma of the breast. This lesion, adenomyoma, is composed of glandular and stromal, benign-looking glandular epithelium and benign-looking stromal epithelium. These are the glandular epithelium, and these are the glandular epithelium, benign-looking, and this is the stroma, composed of these two elements forming a round or slightly diffuse mass within the myometrium. This is called adenomyoma. Higher power of this section. These are the benign looking glands, glandular epithelium, and this is the stromal, benign looking stromal fibrous or smooth muscle lesion. Two elements, mainly two elements, gland and stroma, gland and smooth muscle. This is called adenomyoma of the myometrium. This lesion also, this is also a glandular slit. This lesion also benign looking glands and stroma, and with evidence of whirling appearance. It is like that of the adenofibroma or fibroadenoma of the breast. This is called adenofibroma. In the breast called fibroadenoma. No evidence of atypical or malignant change. This is adenofibroma of the uterus. This slide represents another pathology of the female genital tract, which is more common. It is called endometrial hyperplasia. Endometrial hyperplasia, which is the cause of dysfunctional uterine bleeding or irregular vaginal bleeding of the female. This is endometrial hyperplasia, usually due to hormonal imbalance. This slide, it is a microscopical section of endometrium, thick endometrium. This thickness of the endometrium may exceed 2 cm. Normal thickness of the endometrium is less than 0.6, 0.7, rarely 0.8, but in some conditions there is an increase in the thickness due to hyperplasia. This hyperplastic change results in bleeding and histologically composed of benign-looking glandular epithelium, less or scanty or less stromal tissue. The glandular epitheliums are forming many glands with back-to-back appearance, and sometimes cystic change. Back-to-back appearance, cystic change of the glands, proliferating glands, benign-looking, no atypia, no complexity of the glands, no frequent mitotic activity, no pleomorphism. This is called endometrial hyperplasia. Usually in endometrial hyperplasia, the section of endometrium is taking more of the half of the field. So this is the low power field, and all the field have occupied by endometrium, while the myometrium, like this is the myometrium. From the beginning of the myometrium to the end, this is all the sections represent endometrial tissue, hyperplastic endometrial tissue. This is an endometrial hyperplasia. بسم الله الرحمن الرحيم. أعزائنا الطلبة، السلام عليكم ورحمة الله وبركاته. This is another slide regarding the pathology of the female genital tracts, a condition called endometriosis. Definition of endometriosis is the transmission or location of the endometrial glands within the myometrium. This is the myometrium, smooth muscle of the myometrium, and these are the endometrial glands, and this is the stroma, endometrial stroma. These glands are located far away from the endometrium. This is the endometrium, and these glands are far away from the endometrium. This is called adenomyosis. Endometrial glands with stroma, and this is the stroma of the endometrial stroma. This is the smooth muscle. There is also no atypia, no abnormal mitotic activity. This is the adenomyosis. Higher power of the glands. Higher power of the glands represent benign looking cells without any malignant change. These are the epithelial, glandular epithelium, and this is the stroma. This is the stroma of the endometrial stroma. This is characteristic feature of the adenomyosis. This is another gland with endometrial stroma. So this is the adenomyosis of the. This is the benign looking endometrium. Also there is some hyperplastic change, and this side we also see endometrial hyperplasia. So this slide represents two pathology. First, adenomyosis. This is one. This is adenomyosis, and the second, endometrial hyperplasia. This is another pathology of the female genital tract regarding malignant tumors. This is a malignant tumor of the cervix of the uterus. This is squamous cell carcinoma. The tumor is showing multifocal malignant aggregations or malignant cells, aggregations of malignant cells and epithelium infiltrating the whole tissue of the cervix. These cells or these tumors are composed mainly of squamous epithelium or malignant squamous epithelial cells. These are not benign, these are malignant cells, squamous epithelial cells with abnormal mitosis, hyperchromatism, pleomorphism, this is abnormal mitotic activity, frequent mitotic activity. These are mitosis, and these are the malignant cells. This is the squamous carcinoma of the cervix. This focus may be more demonstrating. These cells are malignant cells, hyperchromatic, slightly pleomorphic. This is the mitotic activity, mitosis, abnormal mitosis. The features of malignant cells are hyperchromatism, pleomorphism, large nucleus cytoplasm ratio, prominent nucleolus, abnormal mitosis, atypia. All these features are present here. This is non-keratinized squamous carcinoma. These are non-keratinized, predominantly non-keratinized squamous cell carcinoma. All the features of malignancy are here. So please search for all the features of malignancy regarding squamous cell carcinoma within this slide. This is another slides for the pathology of the female genital tracts. It is adenocarcinoma of the uterus. Adenocarcinoma of the uterus. The origin of this tumor is the endometrium. Malignant transformation of the endometrial gland result in formation of adenocarcinoma. The adenocarcinoma, this will result in invasion of the endometrium, myometrium, and may reach outside the uterus. This section from the myometrium and showed many clusters, groups of well-differentiated adenocarcinoma. This is adenocarcinoma, gland formation with cystic change. This is another gland, this is another gland. These glands are composed of malignant neoplastic cells forming acinar or glandular or large ductule. These are the adenocarcinoma. Some of the mucin secreting may be seen there. This is well-differentiated adenocarcinoma. Higher power to see the morphology of the cells. Also hyperchromatic, pleomorphic. These cells hyperchromatic, pleomorphic. Sometimes maybe abnormal mitosis. So this is the adenocarcinoma of the malignant neoplastic cells with the features of malignancy, atypia, hyperchromatism, pleomorphism, mitosis. This is the adenocarcinoma of the endometrium invading the myometrium. Please search for other sites on this slide to see the morphology of the adenocarcinoma. This slide also represents adenocarcinoma of the endometrium. This is well-differentiated adenocarcinoma composed mainly of a glandular epithelium, endometrial glands, but these glands are hyperchromatic, pleomorphic. Pleomorphism, hyperchromatism also seen here in all these cells, forming well-differentiated glandular pattern. This is well-differentiated endometrioid. It's called endometrioid or endometrial carcinoma. All the features of the malignancy are here. This is not benign, this is malignant. So these changes may be due to hormonal or due to other causes, or sometimes radiation may cause the malignancy of the endometrium. This area composed completely of endometrial glands, malignant endometrial glands. This is adenocarcinoma of the endometrium. This slide represents the pathology of gestation or pregnancy. We have two main conditions. Benign lesion of gestation was called hydatidiform mole or H mole, and choriocarcinoma. This represents the benign lesion, hydatidiform mole or called H mole. in which there is a swelling, hydropic swelling of the placental villi with cistern formation and absence of blood vessels. Absence of the blood vessels. In normal placental chorionic villi, there is some blood vessels, but in hydatidiform mole, there is no blood vessels, but there is a swelling and cistern formation. This is another one. Large villi. The villi become large, hydropic swelling, cistern formation. This is the space of cistern. انتفاخ مع cyst داخل يصير cyst within the villi, and there is no atypical or malignant change within the syncytio and cytotrophoblast. These are the two layers of the placental villi without any atypical or malignant change. This is another one. This is the large cistern and maybe ruptured, and these are the syncytio and cytotrophoblast. Syncytio and cytotrophoblast normally seen. This is hydatidiform mole, H mole, benign lesion of the trophoblast tissue or benign lesion semi of the gestation, hydatidiform mole. Regarding the pathology of ovary, we have many lesions. Most of the common lesions of the ovary are the cyst, ovarian cyst. Ovarian cysts classified into either non-neoplastic or neoplastic. The non-neoplastic is functional follicular cyst, corporeal cyst, luteinized cyst, while the neoplastic cysts are either mucinous or serous cyst adenoma, usually, or serous tumor or mucinous tumors. And this is the mucinous cyst adenoma of the ovary, benign mucinous tumor. Benign mucinous tumor. This is the lining of the cyst. This is the cystic wall, and this is the lining epithelium of the cyst, composed of benign simple columnar epithelium benign simple columnar epithelium basal nuclei and tall columnar epithelial cells. Basal nuclei and tall columnar cells. This is the mucinous epithelium. Also, this lining epithelium showed benign features, no evidence of atypia, no evidence of mitosis, no evidence of hyperchromatism or other. This is the lining epithelium, this is the fibrous wall. This is mucinous cyst adenoma. Mucinous cyst adenoma of the ovary. Mucinous cyst adenoma of the ovary. This is the benign looking epithelium of the cyst. This is mucinous cyst adenoma. This is another slide regarding the benign lesion of the ovary. Benign neoplastic lesion of the ovary. Mucinous cyst adenoma. This lesion or this cyst is showing multilocular cavities, multiple cystic cavities. This is the cyst, this is a multilocular cyst. Each one is lined by benign looking columnar epithelium and containing mucinous material within this mucinous material usually have been getting out due to the processing agents like xylol or alcohol, so the cavities looks empty but the lining epithelium is preserved. This lining epithelium composed of benign looking simple columnar epithelium, benign looking simple columnar epithelium with basal nuclei, and there is no evidence of any malignant change. This is benign looking mucinous cyst adenoma, multilocular benign looking or benign mucinous cyst adenoma, benign mucinous cyst adenoma. Thank you.